Dr. Tom Huebner here with Natural Transplants. We're at a almost two-week follow-up with our great patient from a couple of weeks ago, Cheryl. And at this point, we just wanted to show Cheryl because she has an excellent post-operative management so far. And you can really tell that she's been following the instructions. She hasn't tried to manipulate the oozing and the scabs that are up in that area where we grafted into. And the scar is healing very, very nicely. We just took out the sutures today. So we just wanted to talk to Cheryl and just get her perspective on how it's been post-operatively in the first couple weeks. So Cheryl, how has it been for you?
Oh, it's been really good. The only thing that I did after the procedure was take some pain medication, but it was only for the tightness that I felt around the suture line. And other than that, I since stopped taking the medication, and I've just been waiting. I'm in the waiting process now.
The waiting phase, and the waiting phase is the hardest phase.
Yes.
So a lot of our patients, you have to make sure they understand that you're not going to leave with hair the same day you come in, and in fact, you're probably not going to like the way you look when you leave. But as long as you kind of know what you're getting into, I think the expectations can be met, and you're going to be very, very happy. So Ron, if you want to come in here, we'll kind of pan in and kind of show what her head looks like. So again, just shy of 2 weeks. All these little brown dots you're seeing are little scabs. Those are going to fall out over the next week or so. Her head is going to go back to looking generally about normal for her. So some of those hairs that we buzzed away to get to this area are going to grow back in. And then in about 3 or 4 months, all these little scabs are going to turn into hair sprouting through. So if you also want to pan around here, you can kind of see what we can expect with what the scar will look like in about 2 weeks. Now Cheryl, you remember from the first video, she actually had longer hair. But she even elected to buzz down her head in the meantime, which is totally fine. The hairs you can see right around this suture line, which is almost undetectable, are going to continue to grow back, and she will never have an issue with disguising this suture line. Now it's impossible, again, to do this procedure without leaving a linear scar, but if you do it correctly, the linear scar will be as minimal as possible, and you'll be able to style your hair the way you like it. So really excited for you, Cheryl. Really looking forward to the 8 or 9 month mark when we get some significant growth.
So am I.
Get your edges back, start wearing some hairstyles, and really excited. So great. So thanks again for paying this experience forward for other people. We had people that come in and say all the time, like they really appreciate the courage of the patients that go on videos and share their experiences, and then they end up paying it forward in the future. So thank you so much, Cheryl. We'll be checking in with you in a few months.
Okay, it'll be great to come back.
Excellent.
Call us now, 844-327-4247, and ask about our Hue and Hue Plus procedures, which move more hair than ever before. Hope to hear from you soon.